Hey, listen, I'm really glad to have you brothers on today. I'm on with some colleagues. Listen, I'm wearing all kinds of hats today. I'm wearing my Pastor Alex G hat from Fountain of Life. I'm wearing my President CEO hat from Nehemiah and Justified Anger. And I'm also wearing my podcaster hat with Black Like Me. And I'm here with two colleagues who work with me. We work together at Nehemiah. Anthony Cooper is one of my vice presidents of strategic partnerships and reentry services. And then our colleague, Aaron Hicks, who is our Man Up coordinator and who works in several capacities in our reentry areas. Gentlemen, how are you all doing today?
Doing well, thank you.
Yeah, doing well. I think like we spoke about earlier, things don't stop. We got to continue to do the work that we do for the community.
Right. But are you taking care of yourselves as much as you can? Working to be safe?
Taking on safety precautions as well.
Yep.
That's good. Listen, gentlemen, first of all, I want to say I'm proud of my team. I got to let you know. So these gentlemen, Coop, you've been working with me at Nehemiah for how many years?
7 years. It's been 7 years now.
7 years.
Yeah, it didn't look like that. It seemed like that, but it is.
What are you trying to say? You had hair before you started working with me?
You know what? It's a whole lot of truth to that. Now that I think about it. Matter of fact, I need to look at some pictures.
I didn't have all this gray when I started working with y'all.
There's some truth to that, too.
You're going to call me out. This is my show. And Aaron, man, I met you when you were part of our Man Up group. You are now the Man Up coordinator. You replaced me. You took my job. So, Aaron, how long ago was that?
That was probably about 8-9 years ago.
Because you had just come home. You had just come home from prison, and you were part of our Man Up group. A group I facilitated. That's a support group for men. It was designed for a support group for men, for Black men coming out of prison. Listen, I want to just have a brief conversation with you about COVID-19 in jails. There's so many things we can talk about, but I just want to talk to you. One, I just want to commend you men for the work that you do, for using your own life experiences to serve this community. You all are there for men morning, night, noon. You get calls at 2 or 3 o'clock in the morning. You all help to oversee housing, put people in housing. Combined, y'all have placed hundreds of men in prison. I want y'all to know that you're rock stars, that you're heroes, because you're helping to humanize these individuals who went to jail, went to prison, paid their debt to society, and you're helping them to integrate into the community. Because the degree to which people integrate, they can live an integrated life. But if they don't enter properly, they can wreak havoc for everyone. But today, I just want to talk to you for maybe 10 or 15 minutes. I'm concerned about COVID-19 and folks who are in jail. So our Dane County Jail is not a prison. It's a year or less, as I understand it. But we've had a breakdown. So Coop, is it true that it's about 9 cases of folks who are incarcerated or in jail? Is it about 9 cases right now at the Dane County Jail?
That's correct. Yeah, that's correct. And I believe all of them are. And to my understanding, I'm pretty sure they're being treated currently at the UW hospital. Who are, the nurses or the doctors are doing as much as they can do to help people. So yeah.
So Coop, do we know anything about the demographic? Are these folks who just went into jail and they're on a hold? Did they get it from county staff that are wardens? I know they're not called wardens in the jail, but you know what I mean. Deputies.
Yeah, sure. Deputies.
Do we have any idea? I don't want to get us into trouble and suggesting something that's not, but do we have an idea of where this started?
I mean, the thing is that you got to look at it. It's a virus, so we wouldn't really have a real a sense of where it came from, but you got to think about it, that by it being a jail, you have people who are coming off the streets, you have people who are coming from different homes, who knows where it came from or how, but it's the fact that it was there, right? But also just showing that's also another vulnerable population of people that were incarcerated. So we also have to start looking at it as far as, all right, how are we treating people who are homeless, but then also how are we treating people that are incarcerated? How are we trying to make sure that everyone is being served as much as possible?
Right. Mr. Hicks, let me ask you a question. Give me a sense, if you can just do this just succinctly, who's in jail? Because people think that these are folks serving their sentences. But talk to me about people who are on holds who have not even been sentenced, right? Am I wording that correctly? I mean, because there are people that are being held because they've got an initial appearance. So I want to free people's mind that the jail population in Dane County is not just folks who are serving a sentence. Some of these people are waiting to find out what their sentence is, if there is a sentence. So tell me about the people on the front end of that who are not serving a sentence.
Probation holds.
Yeah, on hold. Tell me about what that means.
So I mean, mainly you get individuals who are on a probation hold who just kind of just sit in jail, and the decision is made between the PO officer and their supervisor deciding should this person sit, will this be a sanction, and it could be merely for just a rule violation. It has nothing to do with a new crime or anything like that.
So rule violation could be curfew. It could be a curfew. It could be dating without permission. It could be getting a cell phone without permission. With rule violation, you mean they have not committed a new crime.
That's correct. So it could be anything from you didn't make it home on time, or if you missed going to see your PO officer at a specific time due to whatever circumstances. Those are all rule violations. If you take a loan out, and don't inform your agent, that's also a rule violation. Those types of things.
So those folks can be on hold. I want the people that are viewing this to understand. I don't want them to go to the place, well, they shouldn't have done crimes to be in there, and this is what's happening. I want them to understand these are not people who are necessarily serving sentences. We have people that are just on hold, and it can be just someone who doesn't have an agent. I mean, Coop, I'm just thinking if someone has a DUI and they get pulled over, I mean, you don't just get arrested and then just serve a jail time. You may sit there for a few days until you appear before the bench. Those folks are in there being held too, right, Coop?
Right. Yeah. No, that's definitely true. I mean, and that's why I was saying, as far as it can come from anyone. It can easily come from a deputy. It can come from someone who's coming off the street. It can come from someone who just got picked up. The problem is, I mean, well, I shouldn't say the problem, but what I will say is that, I mean, maybe hopefully at some point they may be able to figure out some type of mechanism where they can test people ahead of time and then try to get them treatment beforehand. I mean, there's so many different workarounds to kind of prevent it from being spreaded in the jail. Placing someone in the hole, I mean, I'm not saying that hopefully our Dane County jail is not doing that. Well, I'm pretty sure they may have to in the beginning until they kind of figure out being able to take them from whatever pod or whatever that they may be in. They may have to put them in a hole temporarily, but that's also adding another sense of trauma to that individual as well. Just something else to kind of think about. And that doesn't necessarily isolate the situation. Once the new jail is built, I think they're going to have some other ways of being able to at least contain some of this stuff, or the new addition. I shouldn't say the new jail, the addition to the jail. But right now, where no one has been ready for this. This is new all the way around the board. So it's not a pointing fingers type of thing. It is a thing that if anything, we have to rely on our physicians and the UW staff and other hospital staff to be able to help us work through this. And we have to work in community in order to make sure these things are being done.
Now, I know the general public doesn't know these names, but you all are reentry professionals, so you're privy to stuff that I'm not privy to, and I'm your boss's 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 boss.
Right.
But do you all know some of the folks that are hospitalized, and are you able to help them communicate with their families?
Currently, now, go ahead, Aaron.
So not so much as far as in the jail. I do know a couple people that's in there, but no one who has been affected. However, in the prison system, I also know which is a little bit different because, you know, in jail, people are going in and out. In prison, people ain't going in and out. So the only people that's going in and out is the officers that's going in and out, the deputies, the sergeants. They are going in and out. And so ultimately, the likelihood of them bringing it in to the prison would be greater because the guys in there are not going in and out. They're in there.
Exactly.
They've been in there for years. So
what are some of the people in jail saying who are not affected but they know what's going on? You said you're talking to people who are in there. I mean, what's that fear like? You sitting there, it's in the facility, you can't move. That's got to feel, man, I don't know, like a Houdini cage being dropped in water or something. So tell me, what are you hearing from folks who are in jail but not affected?
I mean, people are feeling definitely the people are feeling trapped. They're afraid, not only for themselves, but for their family. I mean, there are people who are currently incarcerated who are unable to reach out to their family. And that goes both ways. I mean,
why can't they reach out, Aaron? I mean, Coop.
I mean, because right now, if they don't have, I mean, it can go from them not having funds on their account. Because initially what Dane County did do, I take my hat off to them. They did offer to give people like 15 minutes of free time. And that was early on, but after that 15 minutes, that's not an everyday thing. So, thank you. Yeah.
I didn't mean to cut you off. I just want people to understand what it means if they couldn't call. So they can't call. They're in there. Coop, you're saying that they're isolated. They're afraid.
Right. I mean, because you got to think about it. If I'm isolated in here, but then also once I leave out of there, if I don't have a place to go, if I don't, you feel trapped. No matter what, you feel as though, I mean, especially for the ones who are homeless, that's a whole nother situation within itself. So I mean, even though you may not necessarily be locked up, when a person is being released, you're still locked up in your mind because you don't know where to go. And even though there's a lot of information that's being put out there, the governor is doing all he can do. Our staff, other agencies, everyone is doing all that they can do to be able to put that information out there. But there's still a lot of stuff that what people just don't know. I mean, in terms of being able to protect yourself, and in terms of being able to even as simple as noticing some of the symptoms.
Right.
Yeah, and I think just to add on to that, I mean that having that kind of being in a space where you can't move, you can't go anywhere, and knowing that there is something out that's, I mean, affecting the whole world. That in itself brings its own trauma to you. Your own fear, because it's like, okay, I can't do nothing. I can't protect my loved ones. I can't even protect myself. So you become vulnerable both ways. Your family you're not there to support them, and you can't even do anything for yourself. You got people coming in and out of here that's actually getting locked up for, PO holes or for a new case or whatever. And you also have officers, sheriffs and stuff coming in and out of there as well. So it's like you don't have the means to be able to sanitize everything or do all of these different things. So ultimately, you will be operating out of fear because you're in a very vulnerable situation and there's not much you can do about it at all.
Wow. Coop, what do you think jail should do? Let people out who are on holds and have not committed violent crimes? What are some suggestions that you think as a reentry professional that they can do to alleviate some of the pressure and exposure to people who should not be exposed?
The responsibility. No
one should be exposed. I'm sorry. No one should be exposed.
Right.
But what can they do to alleviate that?
The responsibility of the release will actually come from Department of Corrections.
Okay.
So that's one piece. But I do think
do you think that should happen?
Yeah, definitely. Especially definitely that should happen. And if there's a way that being able to supply actually some type of sense of security. I'm not talking about releasing someone and putting them out on the street, but being able to release them even to hopefully their own home. If they don't have their own home, that they at least have some type of other connections out here in the community. Even for us, we have additional housing when we do have space, but right now we're full to capacity. But at the same time, there's other agencies that who can probably partner on that as well, as far as for housing. But yeah, I do feel like if it is possible for a person to be released, definitely that should happen more sooner now than later.
And I would have to echo that same thing, because it's just that serious. I mean, I would definitely, you got elderly people that's sitting in prison that probably could definitely be let up out of there.
Exactly.
To come home to their families and loved ones. So definitely, I would definitely echo that same thing that Anthony just brought out.
Mm-hmm. We're switching subject just a little bit, but I've talked with at least you, Coop, about the elderly who are incarcerated, who are serving long sentences. They're under the the old law. And now it's truth in sentencing, and they've got illnesses, diabetes. They've got the kinds of things that make them vulnerable. It would be something if the Departments of Corrections would let these folks come back out and be with their families. But we could alleviate pressure on the system and just not have people sitting there who are no longer a threat or danger to our society. I hope that somehow the humanity of folks will kick in, and we will begin to tell the truth about who's been helped enough inside prisons, and just being there only makes them more hopeless and does not help to restore them and let those folks come back home.
Right. Yep. You hit it right on the head. Yeah. Yeah. Definitely. Those individuals, and those are men and women, right? They would be better served out here in the community than they would actually be served in prison. Right. You know what I mean? So, and then also even being able to have the support, but even once they're being released, let's really give them support out in the community so they can be, so things can be managed. Because if we're not doing that, either way, we've already lost them. Right. So if there's aorta challenges and things of that nature, or if there's, just ways of people being able to understand what the new wave of life is right now, you know what I mean? So how to be able to adapt. Those are the types of things that we need to be able to implement outside of the prison as well as inside of the prison.
Right, because I mean, on one hand, if you think about it, gentlemen, on a good day, men and women who are incarcerated, we're speaking specifically about African Americans. On a good day, those who are incarcerated or coming back home are in a tight spot. You add COVID-19 to that, it creates a new normal that feels a lot like the chaotic old normal. So a lot of people are talking about new normal, but not knowing about things from day to day, the uncertainty, figuring out about my health, who's going to take care of me. There are people who live like that every day, and then COVID-19 happens on top of that. So I appreciate the fact that you all are saying we got to meet those basic needs. There's already a pipeline from schools to prison. We already have that. And we already have stressors like diabetes, hypertension, heart disease that are often caused by stress, eating-related illnesses, stress-related, eating-related illnesses. And all those things make these populations vulnerable. And I'm concerned that we'll be talking so much about COVID-19, and we should. I'm not saying we shouldn't, but we forget that there are people who are already at risk physically, physiologically, and emotionally because of systemic oppression, racism, inadequate schools, broken families, missed opportunities, the lack of community resources, et cetera, et cetera, et cetera. We are now seeing another level of a beating happen to folks because they're poor and disenfranchised. And how much more can folks take?
Right.
Yeah.
Wow.
Yeah. So it's serious.
But and something and man, it is one of those things, again, and both of you all know me very well, where I will always kind of force on us trying to figure out ways or inviting other ways of being able to make sure that we're working together to be able to get things done. Because I mean, this is something there's no way in heck, I just say heck, that that we'll be able to, you know, do this by ourselves. You know, I think it's been a blessing to be able to partner up with different organizations and really try to see us leaning on each other and working together as a community.
We're going to need that. Our team, Nehemiah, just received a $20,000 grant that was raised by the Boys and Girls Club and United Way. We're really fortunate to have received that. Kudos to both to Boys and Girls Club and to United Way for just thinking that way. I think they raised about $1 million in our community for COVID-19 response. The community still needs to be generous because the pre-existing issues are still there, homelessness, all those other kinds of things. But Coop, just talk to me a little bit about what we're going to accomplish with the grant. That's to help to make sure that there's food and things for men, because we own facilities. Nehemiah owns facilities that men can live in when they come out of jail and prison. Mm-hmm. So these dollars will be used for what?
Right, to be able to actually to be able to give them that extra support from food, bus tickets, ways to be able to help them navigate through not only our systems, but then also the systems throughout the city. I mean, primarily it may even for some be able to help them as far as for their rent.
Wow.
Yeah. Wow. So it's a lot of.
That's major.
Those are all just the kind of the main points to be able to at least assist them, but then also being able to still, and with the help of, I mean, our staff will still be guiding them along the way, and as well as being able to, with our Man Up group, the plan is to make sure that we're doing those at each houses and also doing follow-ups, because those men are also doing those men in those houses are also being traumatized by this as well. I have guys who call 1, 2, 3 o'clock in the morning and just, hey, like, Coop, man, like, what is going on? I mean, they just heard something new on the news, or you know,
they were
like,
watching CNN
this is,
all night.
Yeah, and that was never a part of their norm, but now that it is, how do we deal with it? Why do you know what I mean? Exactly. So, you know, those are the types of things that what we're helping people navigate. And the blessing is that we've been able, through partnerships, have been able to definitely be able to touch people in a different way, to be able to help them not only navigate their own thoughts, but and not saying that we know everything, because we don't, but we have partners who do. Who know what we don't know, and so being able to ask those questions to our partners and say, hey, look, what do I tell a man who is actually, in some sense, rightfully so, almost freaking out about everything if he hears someone have a sniffle, feeling as though that person has COVID. Those are the types of things that what we talk about.
Wow, that's fantastic. And listen, the government's been giving money to buy out banks and car companies for decades. And so I think it makes sense that resources are being made available to help these individuals. Because again, these are men and women, with our housing situation, these are men who paid their debt to society. They went to jail, they went to prison, they came out. Some of them are seeing their officers or parole agents, and they found housing, they found jobs, and they're getting their lives back together. These men are not, by and large, a threat to society. Along comes COVID-19. And so this grant allows us to stabilize those folks, because those are our future workers and leaders. I mean, 10, 15 years ago, we wouldn't have known that you two men who had come back out of prison would be on this video call with me, reentry professionals working in this area. But it's because you were able to find stability, friends, networks, employment, family, so that you can be here today. You two are examples of why we provide housing and job, and Man Up is our weekly men support group, because typically men who are coming out of prison get support from therapists, counselors, agents, social workers, but not Black men who look like them who've also been incarcerated. So it is a very culturally relevant, lived experience support group that resources and builds capacity in folks. It's not just men, it's not just Black men, but you all are building capacity in folks and keeping people in the community. So I want to say to you all, I'm very proud of you. I'm proud of the work that you do. I'm proud that you have taken your own pain. Aaron, I think you said this, Your former tests have become your testimony. Your scars have become your stars. And you all are taking the calls that many other people aren't having. You're intervening when there's crime in the community to keep retaliation down. And this community would not be as safe as it is. You all probably wouldn't say it, but I'm going to say it. This community would not be as safe as it is without folks who've been formerly incarcerated like you and your team, who are helping to clean up the mess that's been made. You know, game knows game, but you all are coming at this as professionals who have been trained with certifications, and you're helping the most vulnerable in our community among us. And I just trust that the people you're pouring into are going to be volunteers, board members, team members, reentry coaches, which is a position we created years ago. You remember that? Reentry coaches. Yep. You all are helping to make this community safer. And I just hope from time to time I can bring you back on to just talk about your perception of how COVID-19 is having an impact on the vulnerable incarcerated population. So my guests today have been Aaron Cooper. I didn't put you two together. Anthony Cooper, Nehemiah Vice President of Strategic Partnerships and Reentry Services, and his colleague, Aaron Hicks, who is our Man Up coordinator and does a number of other things to keep Madison safe and to help men and women coming out of prisons and jails to have a smoother transition back into community. You gentlemen are some of my heroes, and I appreciate what you do for the community, and I know your families and friends must be as proud of you as I am. Thank you.
Yeah, thank you. Thank you as well.